An outside clinic's ultrasound revealed a calcified parathyroid mass. Ultrasound showed a mass in the lower part of the thyroid gland, and the internal hyperechoic foci showed ring-down artifact at the back, indicating air. The first thing you might think of is esophageal diverticulum, but the mass had no connection to the esophagus. In this case, you might think of the paratracheal air cyst when the mass is located at the lower of the right thyroid gland. It's another case of the paratracheal cyst. The echogenic spots that you can see here are also dirty shadows by air. This is a 75-year-old patient with a large, softly palpable mass in this area. So FNA was referred. On ultrasound, I have a lesion pushing forward the right thyroid. This lesion is hyperechoic in front and a reverberation artifact in the back. This artifact is also visible in the trachea right next to it. On ultrasound, it was highly likely that it was a lesion containing air, so we performed CT instead of FNA. CT confirms a large paratracheal cyst. Reverberation artifact is a phenomenon in which an ultrasonic beam from a transducer is repeated. Until energy is reduced between the surface of the transducer and the strong reflector that is close to the surface of the transducer. On ultrasound, these images appear to be bright parallel lines with regular distance intervals. And the virtual images visible by each of these lines become blurred further back. This is common in trachea. When you perform a thyroid ultrasound, these two lesions are relatively common ones containing air. Esophageal diverticulum appears above or below the cricopharyngeus muscle. When you find a mass at the back of the upper or mid of the thyroids, you should consider the nodule can be an esophageal diverticulum. In the case of the esophageal diverticulum, the lesion is commonly seen on the left side because the esophagus is mainly located on the left. Sometimes the lesion can be seen on the right, as the esophagus is not uncommon on the right. Most of the paratracheal air cysts are right-sided, and left location is extremely rare. It is often mistaken for a parathyroid lesion because it is located below the thyroid gland. Let me summarize it. When you find an echogenic lesion at the thyroid gland or near the thyroid gland, you can think of the possibility of the lesion containing air. Your knowledge can avoid unnecessary FNA or CNB, which can result in severe complications. One way to do this well is to practice repeatedly looking at air on ultrasound. Thank you.